Hello guys, good day. This is Anna of Reinforcement Club. Today we're going to talk about hemochromatosis. So hemochromatosis is a disorder in which the body stores too much iron, leading to toxicity, damaging the vital organs and tissues, particularly brain, pancreas, liver, skin, and heart. The first person who happened to discover the first presentation of hemochromatosis, which is already in the late stage, was Armand Trousseau, last 1865. By the way, he was a French physician. So, in one of his odd days, a patient came in to his clinic presenting a bronze colored skin pigmentation, liver cirrhosis, and diabetes mellitus. So from that day on, they were able to come up with this classic triad of hemochromatosis, which is liver cirrhosis, diabetes, and bronze pigmentation of the skin, which is already a late sign of hemochromatosis, which means that the patient is already experiencing uh, multiple organ damage due to iron overload. In Ireland, hemochromatosis is the most common inherited disease affecting thousands of individuals. Ireland also has the highest cases of hemochromatosis, which means that 1 in 5 Irish people are carriers, and 1 in 183 have two genes.
What causes hemochromatosis? So we have two factors to consider. The first one is the precipitating factor, and the second one is the predisposing factor. Now, when you say predisposing factor, it means that it runs in the family. It just so happened that you have a family background and it could be you. So, in other words, this is hereditary. So, hemochromatosis is believed to be originated from Celtic people, and it is common among Northern European descendants. So last 1996, there was a discovery of HFE gene mutation, which is common in a large population of hemochromatosis patients. So what's going to happen if you have this HFE gene? So normally when a person eats, there is a hormone called hepcidin in the gut, which inhibits the transport of iron from the gut into the blood. But with the presence of this HFE gene, this gene instructs the body to lower the production of hepcidin. And as a result of that, there is a huge absorption of iron from the gut into the blood, as well as the accumulation of iron in the vital organs like pancreas, liver, and heart in the long run, not abruptly. So in terms of precipitating factors, the the iron overload happens because of multiple blood transfusion due to blood dyscrasias or blood disorders like thalassemia. Hemochromatosis usually develops between the age 30 and 50 years old. And here's the catch: 75% of the patients were asymptomatic. They were just happened to discover that they have it from random checkups by their GP. And some of them decided to have themselves screened due to the information from their relatives that one of them have hemochromatosis. The early signs and symptoms of hemochromatosis are fatigue, arthritis, which is joint pains in the knee, hands, and shoulder, as well as abdominal pain. So, these are the common signs and symptoms of hemochromatosis. So, in the scan, the doctor can also appreciate the extent of iron accumulation in the liver, as well as the enlargement of the liver. The same is true with MRI. The MRI can assess the amount of iron that has been accumulated in the heart and liver. What are the complications of iron overload in the vital organs? Now, in the liver, it's liver cirrhosis or liver fibrosis. In the heart, cardiomyopathy leading to heart failure. Cardiomyopathy is a condition in which there is a weakness of the pumping of the heart muscles throughout the body because of the accumulation of iron leading to heart failure in the long run. In the endocrine system, we have type 2 diabetes, hypothyroidism, hypopituitarism. Too much iron also affects the secretion of the hormones affecting the reproductive system of both men and women. So, for some men, they have difficulty of maintaining erection to impotence. And for women, they have irregular periods or absence of period. In the brain, they have cognitive dysfunction. In joints, of course, arthritis, and in the skin, the bronze pigmentation, color of the skin, resulting to the mixture of melanin and iron. Now, how to diagnose hemochromatosis? So, in the screening, once a patient or a person goes to the GP, so they're going to take the transferrin saturation and ferritin level. So these are just one of the blood works that will be done by the GP. And once this transferrin saturation and ferritin are high, the doctor then proceeds to the screening of the HFE gene mutation. Now, some people are positive for HFE gene and some are not. So that actually happens. But even though some people are negative for the HFE genes and then they have this high iron level, they are still considered hemochromatosis due to other gene phenotype or other gene trait. They are still hereditary hemochromatosis. It is really quite difficult to diagnose hemochromatosis sometimes because ferritin in the first place is an acute reactant to infection and inflammation. So it means that when you have inflammation or infection, the ferritin goes high. And in some cases, there are people who have, both parents are carriers of HFE genes, but their iron levels are normal, so within normal range. What their doctor usually suggests them to do is to just keep an eye on their iron level and never settle to just leave it. Just keep it monitored every 6 months, every year, or otherwise do the screening in some point. There are also other people who have one parent carrier of the gene, while the other one is still under investigation, and their iron levels are all absolutely normal. So the same thing, the doctor instructs them to keep an eye on their iron level, as well as take note of the signs and symptoms of hemochromatosis. And in the most part, there are also patients who are negative for the HFE gene mutation, but they have high iron level. So they are still treated as hemochromatosis, hereditary, due to other traits or phenotypes. So the same thing. When it comes to treating hemochromatosis, the best treatment of all ever, which can be done by everyone, is simply prevention. by screening. If you feel that you might likely have this, that you have a probability of getting it, get yourself screened as soon as possible. Get it seen, get it detected as early as you can. Hemochromatosis is easy once you have it under control. You just put a little effort, and those effort, look, I'm telling you guys, is always worth it. If you refrain from drinking, if you quit drinking, if you quit smoking for your hemochromatosis, it will extend your life. It will, you will see the effort. Get yourself screened as early as you can. I'm telling you, the complications are terrible in a disease which can be managed with your commitment and effort. Other than that, treating hemochromatosis is just a venesection away or phlebotomy. So, in this procedure, the nurse or a doctor will take 500 mils of your blood every 1 to 2 weeks, depending on the protocol, to lower down the level of your iron up to the optimum 50, and a reasonable transferrin saturation of at least 20%. However, if your iron level is within normal level or under control, you don't need venesection. What you need is simply monitoring your iron level every 6 months or yearly. Keep it under control, and it's important that you have to be on the top of it. You are the only key to your good health and success, and you will see the fruit of your labor, to be honest. Yes. To some people who do not tolerate phlebotomy or refuse to have phlebotomy, the doctors might can have them or will have them with this so-called iron chelation drugs. And the last resort of this is liver transplant, but the doctor wouldn't recommend liver transplant for patients who have hemochromatosis unless if it's really necessary, because it has liver transplant has high percentage of mortality rate. When it comes to dietary recommendations, it's way better to avoid alcohol because it is hepatotoxic in the first place. Minimize the intake of vitamin C and citrus because it encourages or it increases the iron absorption in the gut. And of course, you have to limit or moderately eat red meat because that also has high iron level, including the internal organs. And also avoid raw seafoods because there are some bacteria who love iron and take advantage to it. And once again, this is Anne of Reinforce Me Club. Have a lovely day ahead. Thank you very much for your time.